Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. You're probably wondering, what's going on with this image here? Well, the astute radiologist would immediately recognize, without the red arrow, that there is a bright white spot, and that is a classical lesion associated with multiple sclerosis. We're going to be discussing this and much more in this presentation on demyelinating disorders pathology. This is covered in your book, Medical School Pathology and Step 1 Review. This and the website have everything that you need to succeed and do extremely well on Step 1 and in your coursework for pathology. Highly recommended. Now let's get into demyelinating disorders. Demyelinating disorders are pathologic conditions due to the degeneration of myelin. Now we know that axons are insulated by myelin, right? And this myelin is there to act as insulation so that electrical signal stays within its defined region. And this increases the conduction, efficiency, and speed. Oligodendrocytes myelinate the central nervous system, and Schwann cells myelinate the peripheral nervous system. Myelin and oligodendrocytes are typically destroyed in demyelinating illness, but the axons are typically retained. Examples of conditions that you must know because they are highly tested include leukodystrophies, multiple sclerosis, subacute sclerosing panencephalitis, PML, which is progressive multifocal leukodystrophy, and Central Pontine Myelinolysis. I should say myelinolysis, excuse me. Let's start with leukodystrophies. Leukodystrophies are due to mutations that are inherited in the myelin-producing or myelin-maintaining enzymes. To the right, we can see an image from a patient with Krabbe Leukodystrophy. Note the multinucleated macrophages. The most prevalent form of leukodystrophy is Metachromatic Leukodystrophy, and this is caused by an autosomal recessive arylsulfatase deficiency. To the right, we can see the inheritance pattern. So let's talk about metachromatic leukodystrophy for a bit. In metachromatic leukodystrophy, arylsulfatase deficiency results in myelin buildup and in oligodendrocyte lysosomes because it cannot be broken down. And this is a lysosomal storage disease. So there's myelin buildup in the oligodendrocyte lysosomes. Krabbe disease is defined by this galactocerebrosidase P-galactosidase deficiency inherited in an autosomal recessive pattern. In Krabbe disease, macrophages accumulate galactocerebroside. Another condition that you must be aware of is Adrenoleukodystrophy. Now, Adrenoleukodystrophy is caused by an X-linked mutation. To the right, we can see an MRI from a patient with Adrenoleukodystrophy. Note the anterior white matter is spared, but at the caudate heads, you can see a marked loss of posterior white matter, as well as reduced volume and increased signal intensity. Adrenoleukodystrophy causes the addition of coenzyme A to long-chain fatty acids to be hindered. This results in fatty acid buildup that harms the brain's white matter and glands. Now, an important, highly tested condition is multiple sclerosis. This is seen again and again and again. What's that lesion on the imaging there? Okay. So multiple sclerosis is the most common chronic central nervous system disease of young adults, typically between 20 to 30 years of age, and is more frequently found in women. Multiple sclerosis results from autoimmune myelin and oligodendrocyte destruction. To the right, we could see a histologic section from a decolorized microscopic image of multiple sclerosis. Remember, multiple sclerosis is associated with HLA-DR2. That's HLA-DR2 for multiple sclerosis. Highly likely that you will see that. And for some reason, multiple sclerosis is observed more frequently in areas further away from the equator. Multiple sclerosis is also associated with recurrent neurologic impairments with times of remission that are present. So there's this multiple lesions that are present in time and in space. Some clinical symptoms of multiple sclerosis include blurry vision, vertigo, internuclear ophthalmoplegia, hemiparesis, weakness, and even malfunction of the bowels, bladder, and sexual systems. Both magnetic resonance imaging and lumbar puncture are used to diagnose multiple sclerosis. On MRI, you should see those plaques, and those are the areas of white matter demyelination. Now, the lumbar puncture findings of multiple sclerosis will show increased oligoclonal bands, which you will see, increased lymphocytes, and myelin basic protein. Treatment of multiple sclerosis depends on the severity or the timing of the attack. High-dose steroids are used in the treatment of acute attacks. And interferon beta therapy for a long time reduces the risk of progression of disease. Gross inspection of brains with multiple sclerosis typically reveal white matter plaques that appear gray. Here we have a photomicrograph of a demyelinating multiple sclerosis lesion. Note that CD68 highlights macrophages, which are present in abundance in conditions like multiple sclerosis. And here is a slide that is above your level of needing to understand or know. I just put it in here because it's pretty. So don't torture yourself with this. If anything, remember that CD68 stains the macrophages because you'll see those with multiple sclerosis. Now let's move on to another commonly tested condition known as subacute sclerosing panencephalitis. Now, in this condition, it is progressively bad, and it could actually be fatal. Subacute sclerosing panencephalitis is due to the measles virus lingering, slowly spreading the infection throughout the brain. Typically, measles infection starts in utero. The neurologic symptoms associated with measles infection manifest in childhood. Subacute sclerosing panencephalitis is characterized by viral inclusions in oligodendrocytes and gray matter. Progressive multifocal leukoencephalopathy is another condition that you must be aware of. Progressive multifocal leukodystrophy is caused by JC virus, and it's an infection of oligodendrocytes. For those that are curious out there, JC stands for John Cunningham. To the right, we have imaging from a patient with progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy is due to JC virus. That's a must know. And JC virus is also known as human polyomavirus 2. The latent JC virus is reactivated by immune suppression, such as an HIV infection, AIDS, leukemias, immunosuppression status post an organ transplant. And speaking of which, let's talk a little bit about HIV, because that shows up frequently as well. With HIV, what are the cells that are initially infected? Lymphocytes, correct? Specifically, the CD4 positive T helper cells, right? That's important to know. If I was in a test-taking situation, I would definitely know that. Speaking of which, how does the viral RNA get onto the DNA? Reverse transcription, right? That's how the RNA is converted to double-stranded DNA, by the viral enzyme reverse transcriptase. That's another important thing that is highly tested, okay? But back to progressive multifocal leukoencephalopathy. In this condition, rapid progression of neurologic symptoms such as dementia, paralysis, vision loss can happen. And death can eventually ensue. Now let's talk about another very important, very high yield condition called Central Pontine Myelinolysis. Central Pontine Myelinolysis is focal demyelination of the pons due to rapid intravenous hyponatremia correction. And this happens at the level of the anterior brainstem. To the right, we have imaging of this condition. Risk factors for central pontine myelinolysis include liver disease and alcoholism. Locked-in syndrome is the result of central pontine myelinolysis. And what characterizes locked-in syndrome? Well, locked-in syndrome is characterized by acute bilateral paralysis. But you're not locked in. You're outside. You're rocking out because you completed another presentation. Now remember the high yield stuff, the important tested stuff, the imaging, right? Some of the classic features. I know you do. I know you remember it all because you're smart. You got this. I believe in you. Everyone's rooting for you. And we'll see you next time. Till then, take care.